You're listening to the Fix My Feet podcast. Solutions for every step in your journey with the nation's leading foot and ankle specialists.
Hey everybody, welcome back to Fix My Feet podcast. Again, I'm Dr. David Waters, board certified foot and ankle surgeon here with two colleagues, Dr. Evan Leonard, foot and ankle surgeon, and Ashley Anderson,
hello.
Physician's assistant. How you guys doing?
Great.
Doing great.
Good.
Doing great.
We are going to talk about something super common in the foot and ankle world, and that is heel pain. And I think all of us agree it's one of the most common things we see and talk about patients with on a weekly basis. We see multiple consults every week for heel pain. And so it's something I think I was looking at the most Googled things that involve the foot and ankle, and plantar fasciitis is almost in the top 3 all the time. So it's something that a lot of people have a lot of questions about and that we deal with all the time. So I thought we would start out just by way of education to patients. You know, I think a lot of patients think everything is plantar fasciitis, but that's not always the case. So Evan, what do you think? What are, just for patients' awareness, what are some of the things that could be going on when we're dealing with heel pain?
There's some other options as far as chronic heel pain, especially on the bottom. It can be related to nerve impingement in that area, that you can have pain associated with what's called like a tarsal tunnel or what's called a Baxter's neuritis with some nerve impingement in that area, which can mimic similar symptoms to some heel pain like plantar fasciitis. You could have a bone contusion, you could have a stress fracture, you could have other things going on that are heel pain. So not necessarily everything's going to be plantar fasciitis, but it is something that can overlap with other things too. So it's not mutually exclusive with other things. You can have a combination of things too, for sure. So
actually, if a patient or somebody out in public's worried about whether it's plantar fasciitis or whether it's one of these other things, if they listen to this podcast and think, oh, maybe it's something else, what are some symptoms that would lead them more maybe towards plantar fasciitis or towards like a stress fracture or a nerve entrapment or something like that?
So usually plantar fasciitis, classically, it's like the center of your heel. When you step on it, it's just like that fire poker straight through the heel in the very center of that, like in the bottom part of your heel. And it's like when you first get up in the morning out of bed, or if you've been resting with your feet a long time, you stand up, it's those first initial things, and it tends to get better once you ease it out, stretch it out a little bit. That's usually plantar fasciitis. And then if it's like a stress fracture or something like that, usually it's kind of a consistent pain, and then it hurts worse when you're off of it sometimes because all of that's around it. I haven't seen as many stress fractures recently in the heel, but it would just be something that's kind of consistent. It's achy. It's not that one spot that hurts. It's if you were to pinch your heel or something, it's just that whole heel is hurting on the sides. And then for neuritis, it would be if you have any like kind of numbness or tingling as like an addition to what's going on in your heel, or any numbness that could be part of the reason. If it's just directly in the center of your heel, especially if you find that one spot, then that's usually commonly plantar fasciitis.
No, I think all those points are well said. You know, stress fractures, just like you said, it's not just like right when you get out of bed in the morning always. It's fairly consistent. It gets worse the more you're on it because, you know, you're on it, you're using it, you've got, something going on with the internal structure of the bone. And neuritis, just like you said, if you get pain that starts radiating up the leg, especially around that inside part of the leg, we have to seriously consider, that we might have something else going on, or as Dr. Leonard said, that we have a couple of things going on. Could have plantar fasciitis, and that fasciitis could be creating an entrapment of the nerve along the way. So there could be a couple of different things going on there. So, I mean, patients are always, wanting to, self-treat or do something on their own before they necessarily come and see us and talk to us about what's going on. What do you think, Dr. Leonard? When's the right time to come see somebody like us with heel pain, or, when is it okay to do a couple of things at home? Where's kind of that line? I think patients always wonder, when is it worth the visit to the doctor's office?
Yeah, I mean, I think it's reasonable to try a few things at home, especially because, like you said, most people have probably heard of plantar fasciitis, probably understand the basic symptoms of it, probably understand a couple of the treatment things that they've either seen on Google or heard from a friend or something like that. So definitely, I think that's okay for a couple weeks. Now, I think the disconnect is that most people end up coming in. I'd say the majority after like 6, 9 months because they either assume it's going to improve over time or they don't really have time to go see anybody about it, and it's just not bugging them enough to warrant a trip to the doctor's office. So they can kind of keep it at bay a little bit. But I think the longer it goes on, the harder it is to treat because the more inflammation you have, and then the more chronic the problem becomes. So I think it's reasonable to try a few things at home first, but definitely sooner rather than later to get things started with a visit to the doctor's office.
Yeah, I think the other thing that patients need to understand, and you touched on this a little bit, that the plantar fasciitis comes in different varieties. There's very acute plantar fasciitis, which you talked about, a couple weeks old, new onset heel pain, pain when you get up out of bed in the morning. But the longer it stays, we evolve from a condition of acute plantar fasciitis. And when I say acute, I mean like very new, very fresh, to more of a chronic state where this has been going on for multiple months. Now the fascia is a lot thicker, and could be evolved into more like a chronic fasciosis type condition, and the treatments could start to vary at that point. And so another reason why I think early intervention is better than later intervention. Do you agree, Ashley, with that? Early intervention rather than later intervention?
Yeah, I think so. And I think a lot of patients, from what I've seen, is just when they come in, if they've heard of plantar fasciitis or had people treated for it, they're expecting almost like an injection in their heel or something to get rid of their pain fast. And that works really well. Usually if it's acute, when it's like only been a couple of months old, that treatment works really well for that, and it will help your pain a lot. The longer it sits though and it's chronic, then the injections just don't work as well. So it's not as instantaneous of a relief of pain as well. So sometimes based on that treatment, it might not be that instant pain relief of what you could have had if you came in sooner.
Yeah, for sure. I totally agree with all those comments. And that leads us into what we want to spend the majority of today talking about, and that is, maybe what are your treatment options when it comes to plantar fasciitis? There's a lot out there and a lot of different ones. So I thought we would hit on a few of the key ones that patients tend to know about or read about on Google, and when they're good, and give some more real established evidence. I almost lost the mic there, guys. Did you like that? About
It happens.
what's going on. So I thought Dr. Leonard's I think the foundation is just good old conservative treatment. Do you want to go through maybe what are some of the real conservative measures that patients should think about when they're dealing with heel pain?
Yeah, there's some solid ones that most people try a couple of them before they come in, I think is pretty common. But when you're looking at conservative stuff before you get into any kind of medication or anything like that, you're looking at supportive shoes, decreased barefoot walking. You're looking at some sort of an insert in your shoe, an insole, an orthotic of some sort, extra support. You're looking at massage, kind of break up any inflammatory scar tissue that's going on. You're looking at icing to help with some of that inflammation as well. And then you're looking at stretching your gastrosoleal complex or your calf muscle basically to help improve your range of motion and hopefully take a little bit of stress off that plantar fascia as well. So those are pretty much your conservative options, and long term those are going to be your best bets in terms of keeping this at bay and from coming back once we get it calmed down and treated for you initially. And then once you work your way up from there, then you get into some more medication type things all the way up to and including surgical options. So
for patients that might not understand why stretching and not going barefoot are so important, Ashley, what can you give the explanation, like mechanically, why those things work, so patients will understand like why we harp on that so hard when we start talking about getting your plantar fasciitis better?
Yeah, the way I usually break it down in the office is that when we normally walk, we're walking with our heel first for heel strike. That's the normal gait pattern. And so when you put your heel down, you're putting a lot of pressure mostly on that heel, but then also on the ball of your foot. So those are the main points of contact. So what happens is if your plantar fascia is tight, it goes and extends across the whole bottom of your foot. So it inserts on your heel. So every time that fascia is tight or something, it's just starting to get thick, it starts to pull off of that bone more and more, and it starts to get little tears in it. So what ends up happening is it's building up scar tissue and inflammation right there on that heel. So when you're stepping down and putting all that pressure, you're just re-injuring that area pretty much just because it's inflamed or tearing as scar tissue. So when you have some sort of insert or that support, when you're walking barefoot, there's nothing there except for that fat underneath your heel and your bone and the fascia. So when you have inserts, better supportive shoes, you're able to not put all of your weight just in those normal pressure points of how we would walk. So like, for instance, when we have any sort of insert that you would get from our office or that what we would recommend, it has a little bit of a supportive arch in it. And that's so that it's going to support that midfoot or that middle part of your foot, as well as taking off some of that weight just from your heel. So you also have contact in that middle part of your foot to offload just putting all that pressure on your heel while you're walking or standing. A lot of people who stand also can get this problem, not just from walking.
Prolonged standing, I think, is one of the worst things with plantar fascia. There's no question about that. Foot fatigue, as those muscles, the intrinsic muscles, or the muscles that are just down inside of the foot, when those fatigue, then the fascia really starts to take the brunt of the supportive structure of the foot. And then that's where we get under a lot of strain. And just like Ashley said, as that fascial strains to support or control what we call in medical word pronation, or the flattening of your arch, that's where we have that tearing that happens, and this nasty cycle of tearing and scarring and tearing and scarring. And so, getting a shoe that helps control some of that and take some of that tension off, or an insert, and not going barefoot is a huge advantage to you while you're getting better. Now, I always say, patients, you don't have to stay non-barefoot for forever. Once we get this under control, but being barefoot while you're in that real acute and or chronic phase of plantar fasciitis can be very challenging to get a lot better with that going on. Yeah. So, I think that those are really the foundational treatments, and like Dr. Leonard said, things you should try at home. Definitely stretching, and you're stretching that calf muscle. Maybe you can explain that a little, Evan. Why do we ask you to stretch the calf muscle instead of, somebody might think, we should be asking you to stretch the foot, or we should be asking you to stretch other things. Like, why does most of the physical therapy and stretching revolve around the calf muscle there?
Yes, there's pretty good research showing what's technically called equinus, or having contracture in the back of your leg, decreases the amount of dorsiflexion or upward motion you can do at your ankle joint. And it's a very common thing to have. It's just a bigger muscle complex back there compared to the anterior part of your leg or the front of your leg. And so when that area gets contracted and tight, your foot has to function a little bit differently when you're walking. And a lot of times when someone has a flatter type foot, or they tend to pronate and collapse through that arch, kind of like Ashley was talking about, and put an extra stress along that plantar fascia, your foot will instinctively increase that pronation in order to allow you to clear the ground and walk a little bit better through your gait pattern. And you probably don't know what's going on. Body does it for you just as a protective mechanism, but by stretching back there and increasing that range of motion, you can help take stress off of the foot and off of that plantar fascia. So in conjunction with those other treatments, it does definitely help. And it's just a good long-term treatment that you can perform daily. It's easy. It's pretty quick. It does show that people have improvement with, their pain initially, and then with not getting plantar fasciitis again in the future. So yeah, we do it a lot. Therapy does it a lot. It's pretty common.
Yeah. Yeah. You got to make sure you get those pre-OR stretches in, you know what I'm saying? Before you go into the operating room there.
You don't want to pull a hammy in the OR.
You don't want to have that happen. So
lots of static standing.
So no,
Lock
but
up.
I think for our listeners, I mean, that is the foundation treatment of plantar fasciitis. Good stretching, good shoes, inserts in your shoes, and massage. And we haven't hit on massage, but really, maybe I'll take that one. Really, what happens with plantar fasciitis is you thicken the fascia. And in our office, we use ultrasound to help patients understand and to get a better diagnosis that shows how thick that fascia gets. And the massage its function is to break up that thickening, allow the fascia to glide and get rid of that scar tissue. And so doing those foundational things, are critical in order to get better if you have plantar fasciitis. Now, let's talk. We're running closer on time, but what are some advanced modalities that you might run into more in the doctor's office? Ashley, some things that we can do here that maybe you wouldn't be able to do at home.
So we kind of briefly chatted about it earlier, but one of the things, if it's acute, and that we can try is a steroid injection in the heel. We can always try to calm down pain that way. We'll always talk about orthotics. Custom orthotics is something specifically that we could get in our office instead of in another place. Some other things that we can do, we could always do some formalized physical therapy and refer you on to that. And then also we have a treatment in our office called Shockwave, which is a high-powered ultrasound wave. It's like massage for that foot, like what you're trying to do, breaking up that scar tissue, but it's almost like when they bust up kidney stones with those ultrasonic waves. It's the same thing, but with the foot. So we're trying to shoot that scar tissue with a bunch of different waves to bust it up. So then it will essentially, your body forgets about your fascia when it's super thick and chronic. So you're trying to get your brain to remember, oh yeah, there's something going on down here. It increases your inflammation, so it'll clean out all of that scar tissue that we've busted up. So that's 5 treatments in our office is another way to try to thin that fascia out instead of just trying to treat pain. So it's actually trying to treat the problem.
That's a great point. And hopefully everybody caught that most of the time when we get it, it's in a subacute or a chronic state. It's not in an acute state anymore. Every once in a while we get some smart patient out there comes in cute, we can inject them, get them back on the road. But converting this from a chronic to an acute phase, and Shockwave is actually one of the few actually evidence-based treatments that we have for plantar fasciitis. Well, it's been around since the 70s and it's been published on. I think the latest thing I read was in the Journal for Family Medicine that talked about chronic cases, Shockwave is one of the good treatments that are out there. You may run into some other advanced modalities, things called PRP injections, just to touch on these. This is drawing off your blood, thinning off your platelets, and because the platelets house all those growth factors, and then re-injecting that back around the fascia. Again, the goal is to take a chronic condition, convert it into acute condition so your body can start the healing process with the plantar fascia. So it's super common. Maybe just some parting words from everybody as we're winding down here. Best recommendation from each of you for somebody who might be dealing with chronic heel pain or been having heel pain for a while. Best one-liner recommendation that you can give to these people. We'll start with Evan and then Ashley.
Stop wearing Crocs. Probably the best option, best advice I can give.
I love it.
Just because something, is soft doesn't mean it's good for your foot. So support is better than squishy.
Yeah, I love it. I love both of those. Yeah, and mine would definitely be in agreement with these guys that some kind of supportive footwear is the best thing you can do out of all the things we talked about. If you're doing nothing else, finding yourself the right supportive shoe wear or footwear would be your first initial stepping off point. And then also, if something's been going on for a while, it needs to be evaluated. Don't hesitate. And we can make sure that those things can get taken. It's very treatable. Don't feel like you're going to be stuck with this for the rest of your life. It's very treatable, so come in and get it treated. I think that's it for today. Be sure to check us out on social media. We'll let you know about some upcoming episodes. We've got some cool things about more real common conditions is where we're going to start off with. So ingrown toenails, shoes, bunions, hammer toes, things that are super common. We're going to start off with a bunch of that stuff. So look forward to those. We're at Platte River Foot and Ankle on Instagram, and Platte River Foot and Ankle Surgeons on Facebook and TikTok. And also our Facebook page just for the podcast called the Fix My Feet Podcast. So check us out on social media. Like us, follow us, add your questions and comments. Once we start those rolling in, that'll really give us some really specific content here on the podcast. To everybody else, hey, we're here to fix your feet, baby. Have a good day.
Thanks, guys.
Bye.
Thanks for listening to another episode of the Fix My Feet podcast. To schedule an appointment with one of our providers, visit www.prfootandAnkle.com.